Hi, Sean. How are you today?
Good.
Thank you for coming in. I see that you had an appointment with Dr. Stevens about your asthma.
Yes.
I see that you also filled out a drug and alcohol screen. This is something we do with all patients to see how drugs and alcohol affect their health.
Okay.
To start with, you shared that you use marijuana, and Dr. Stevens recommends that you don't use marijuana because it complicates your asthma.
Yes.
Well, before we talk about that, can you tell me a little bit about your use?
I don't feel I use it very often. I use it a couple of times during the week. I do a little bit more during the weekend. But compared to my friends, I don't think I overuse it.
So you use it to socialize, but you don't feel like you overuse it.
Yeah.
When you're socializing and using marijuana, how do you use it and how much do you use?
Do you mean do I smoke it?
Yes, some people smoke marijuana, some people use edibles. I'm just curious about how you use marijuana.
I typically smoke it. I'll usually do a couple of bowls during the day and a little bit more during the weekends. When I get off work, I usually have a bowl just to relax a little bit.
So a little bit to socialize and reduce stress. How long has this been going on for?
I've been smoking since I was a teenager. It obviously is a lot more now.
So more now that you're an adult.
Yeah.
Thank you for sharing that. According to the answers on this form, you scored in a risky zone. The smoking of marijuana can possibly damage your lungs and make your asthma worse. Marijuana can also interact negatively with other medications that people take. What do you think about that?
Well, I guess it's interesting. And I guess it's relevant, especially since I do have asthma and I do have to take a prescription for that.
So when you think about it, there might be a connection between your marijuana use and your asthma.
I guess so.
I'm curious, what do you like about using marijuana?
What do I like about it? Well, I've been doing it for so long and I barely drink. I guess I see it as a recreational thing. I don't do it for medical reasons, so I guess I just enjoy it a lot.
Have you ever noticed if there's any downsides to your use?
I don't know. I guess I've enjoyed it so much that I didn't even see the downside to this.
Yeah.
I guess I'm not as physically active as I'd like to be. But I still go to work and I still have goals.
I'm curious, what are those goals and what's working and what's not?
Well, for the longest time, I wanted to go back to school. But when I started looking into it, I noticed that there's a lot of applications and steps, and I kept putting it off. I don't know if that has anything to do with smoking.
So when you think about some of your goals, you notice that you've been putting them off and you don't know if marijuana is contributing to this.
Yes.
We do know that marijuana can reduce ambition and people tend to slow down and not do things that they used to do before.
I guess that makes sense.
So given all that, on a scale of 1 to 10, 10 being really important and 1 not being important at all, how important do you think it is that you consider making some changes with your marijuana use?
Maybe a 5.
So you're at a 5. I'm wondering why you didn't say something lower, like a 2 or a 3.
That's a good question. I never thought about weed impacting or hindering my life that much, but my girlfriend really wants me to stop.
So you're noticing that your girlfriend thinks changing could be important, and you're thinking about how it might be impacting your goals. And I'm wondering if you're connecting your asthma appointment with your marijuana use and the role it's playing with your health.
I can see some connections.
Given all this, I'm wondering if you would like to change some part of your marijuana consumption to possibly improve your health and change things with your relationship.
It might be good for me to cut back.
Okay, so one of the ideas would be to cut back. Tell me what that might look like.
Well, maybe smoke less on the weekends and completely cut it out on the weekdays. I think it's something within reason for me.
Okay, so currently you mentioned that you smoke more on the weekend, so you might cut back to what?
Maybe 1 or 2 per day.
Okay, so 1 or 2 per day on the weekends and none during the week. What do you think about carrying out that plan? And then in 30 days from now, we can do a follow-up and I can check with you and see how you're doing.
That sounds good.
All right, great. Well, I thank you for your time. And how about I walk you to the front desk and set up an appointment for next month?
Okay.